Hey everybody, welcome back. This lesson is an introduction to the cranial bones for CT imaging. So what is the purpose of the cranium? The purpose of the cranium is to enclose and protect the brain. The cranium is comprised of 8 total bones, most of which can be seen just by looking at the surface anatomy of the cranium. We'll start with the frontal bone. The frontal bone is the large prominent bone on the front of the cranium. It forms the forehead, the supraorbital margin, that's the upper eye socket, the anterior cranial vault, that's just the anterior portion of the brain cavity, and the frontal bone contains the frontal sinuses, which we'll see when we look at the cross-sectional images of the frontal bone. The posterior edge of the frontal bone articulates with a pair of bones called the parietal bones. The parietal bones form the roof and sides of the cranium. They join to each other on the vertex of the skull at the sagittal suture. Each bone has a central prominent bulge on its outer surface called the parietal eminence. The inferior edge of the parietal bones articulate with another pair of bones called the temporal bones. The temporal bones form the inferior lateral cranium. They contain 4 portions: the squamous portion, the tympanic portion, the petrous portion, which contains the ossicles, and finally the mastoid portion. The temporal bones articulate posteriorly with a single bone called the occipital bone. The occipital bone forms portions of the inferior and posterior aspects of the cranium. The entire weight of the cranium is transferred to the spine through the occipital bone. The next bone of the cranium is called the sphenoid bone. The sphenoid bone is positioned at the floor of the cranium and articulates with all other cranial bones. It includes numerous appendages, such as the greater and lesser wings, the sella turcica, and many more. The sphenoid bone articulates anteriorly with the ethmoid bone. The ethmoid bone is located between the eyes and contains the ethmoid sinuses and the perpendicular plate, as well as several other important appendages. It's also important to know how and where these cranial bones are attached to each other, and that is sutures. Cranial bones are attached at immovable joints called sutures. Some of these sutures have special names. For example, the coronal suture is the articulation between the frontal bone and the parietal bones. The squamous suture is the articulation between the parietal bones and the temporal bones. The lambdoid suture is the articulation between the parietal bones and the occipital bone. Most of the other sutures are simply named after the bones that they connect. For example, the articulation of the occipital bone and the temporal bone is called the occipitotemporal suture, or sometimes the occipitomastoid suture, because the articulation is taking place at the mastoid portion of the temporal bone. So you think you've got it. Here's a quick practice question. What suture is formed by the articulation of the frontal bone and parietal bones? The correct answer is B, the coronal suture. Here's another question. What suture is formed by the articulation of the occipital bone and parietal bones? The correct answer is C, the lambdoid suture. That's been an overview of the cranial bones and sutures. Thanks for watching.